Welcome to our video about blastomycosis. Blastomycosis. You should be aware of the symptoms of blastomycosis. If you think your pet has this condition, you should see your family physician right away. This fungus can be difficult to detect in humans. The symptoms of this disease include itching, a red rash on the back, and itching of the chest. Fortunately, it is treatable. Infected animals are not contagious, and it is unlikely to spread to other pets. About blastomycosis. If you have ever had to go to the doctor to treat an infection caused by a fungus, you have probably heard of blastomycosis. This serious condition is caused by the fungus Blastomyces dermatitidis. Symptoms of this disease vary depending on the part of the body that is affected but can include a cough, fever, and even a rash. The fungus can spread throughout the body and can affect the lungs, skin, and genitourinary tract. It's important to see a doctor if you suspect your pet is suffering from blastomycosis. Symptoms of blastomycosis can include bone pain and muscular stiffness. It can also affect the lungs, throat, lymph nodes, bone marrow, and the epididymides. It can also spread to other parts of the body if the spores are inhaled or swallowed. However, in the majority of cases, it is only the skin that is affected by the disease. People who work in the soil are at high risk of developing blastomycosis. Individuals with compromised immune systems, such as those on anti-inflammatory medications, should avoid working in forested areas. Those who engage in outdoor activities are also at risk. Vaccination against this fungus is not available. However, researchers continue to study the topic to find a way to protect against it. So, how do you protect yourself? Blastomycosis symptoms. While the fungus responsible for blastomycosis is not common in most parts of the U.S., it is fairly common in northern Wisconsin. While it is rare in healthy individuals, it is potentially deadly if left untreated. Because blastomycosis is caused by the breathing in of soil particles, it usually enters the body through the lungs. The infection can spread to other parts of the body, including the skin. If you have any of these symptoms, contact an infectious disease specialist. Acute blastomycosis infection is usually accompanied by fever, muscle and joint pain, and night sweats. This type of infection may also persist and lead to a chronic infection called chronic blastomycosis. Chronic blastomycosis can affect the bones, lungs, skin, and genitourinary tract. Because it is contagious, symptoms can appear quickly, and treatment can be effective in a timely fashion. Although the symptoms of blastomycosis vary from person to person, they are generally the same in most cases. The fungus, Blastomyces dermatitidis, causes the infection. Most patients will develop respiratory symptoms, although the condition can also affect other organs, such as the lungs and the skin. Infection of the eye may occur in approximately 50% of cases, as does infection of the lymph nodes. Risk and prevention of blastomycosis. Although the exact cause of blastomycosis is unknown, it is commonly associated with contact with moist soil. People who work in the soil are at increased risk. People with compromised immune systems are also at higher risk. Those taking suppressive medications are also at a higher risk of developing blastomycosis. In the United States, this fungus is found in the southeastern United States, eastern Canada, and neighboring regions of the Great Lakes. Symptoms of blastomycosis vary from person to person, but they include coughing, chest pain, and heart bumps underneath the skin. In elderly people, the condition can lead to acute respiratory distress syndrome, ARDS. Although blastomycosis is not contagious, it can still infect pets. Pets in high-risk environments, such as marshy landscapes, should be kept away from these areas. This may be difficult to do, particularly for those with weakened immune systems. Also, avoid the soil during rainy periods, or when the weather is dry. If your dog becomes infected, he or she should consult a veterinarian immediately. Blastomycosis is a serious fungus infection that can cause a number of severe and even life-threatening complications. The infection begins in the lungs, and can progress into systemic pyogranulomatous disease. It occurs when inhaled conidia from infected areas enter the respiratory tract. They then convert into thick-walled budding yeast. How blastomycosis spreads. How blastomycosis spread. It's not entirely clear, but it can be spread through breathing in soil particles. This fungal infection thrives in moist, rotting environments, and can infect humans and animals. Because of its geographical distribution, it's most common in the Midwest and St. Lawrence River valleys. However, cases have also been reported in Quebec, Ontario, Manitoba, and the southern Great Lakes. Dogs are more susceptible to blastomycosis than other species. While cats and humans are not susceptible to the disease, dogs are up to 10 times more likely to contract it. Blastomycosis is a ubiquitous organism, and no treatment will completely eliminate the disease from the environment. Luckily, there are some ways to prevent blastomycosis from spreading to your dog. CDC recommendations for prevention include staying away from densely wooded areas, especially for those with compromised immune systems. There is no vaccine to prevent blastomycosis, but researchers are working toward one. In the meantime, a healthy individual can avoid exposure to spores and infection by washing their hands often. It's important to follow all precautions if you suspect you might have the disease. How blastomycosis spread is difficult to pinpoint, but in most cases about half of those infected will have symptoms. The symptoms range in severity, with mild cases disappearing without treatment. Symptoms of blastomycosis typically appear 3 to 15 weeks after exposure. Although most patients recover completely, the infection can spread to other parts of the body, and severe cases can be life-threatening. Blastomycosis diagnosis. Blastomycosis is a fungus that is found throughout the world. It is most commonly found in the south-central and midwestern USA, as well as Canada. People of all ages can develop this infection, but the risk of severe illness is greater for people with weakened immune systems. It can manifest in patients as a variety of symptoms, including respiratory and skin lesions. The most common radiologic manifestation of blastomycosis is airspace consolidation. Its prevalence varies between 26% and 76%. Most patients exhibit consolidation. These areas are ill-defined densities and opacities. Sometimes the area of confluence is quite large and resembles lung cancer. Air bronchograms are usually normal or mildly abnormal, but the most common mistaken diagnosis of blastomycosis is community-acquired pneumonia. A definitive diagnosis of blastomycosis requires isolation of B. dermatitidis from a clinical specimen. A histopathologic examination can support the presumptive diagnosis if B. dermatitidis is detected. The organism is distinctly different from other yeasts on the basis of morphologic features. A sputum sample that contains B. dermatitidis is used to confirm the diagnosis. An infection with blastomycosis usually occurs during an outdoor activity. In Missouri, the incidence of blastomycosis was 12 cases per 100,000 people from 1992 to 1999. The infection was more common in African Americans, and 2 co-workers were affected outside recognized areas of endemicity. These cases suggest that the disease is becoming more widespread in the Midwest and the Great Lakes. Blastomycosis treatment. Blastomycosis treatment varies widely, depending on the patient's condition, immune system, and the severity of infection. Some patients are not eligible for treatment, while others may experience relapses after several months or even years. Listed below are some options for treatment. Most treatment options involve antifungal medication. Some patients require long-term treatment, while others may only need supportive care. While azole therapy is the most common choice, some patients do not respond to it or experience side effects. Symptoms of blastomycosis vary from patient to patient, but typically include coughing, swollen lymph glands, and trouble breathing. The infection may also affect the eyes and throat. The most common site of infection is the skin, but it can also affect the bones, genitourinary system, and muscles. Treatment for blastomycosis begins with a diagnosis and treatment for the symptoms. Antifungal drugs are the most common treatments for blastomycosis. Amphotericin B and itraconazole are the most common treatments, although other antifungal agents are available as well. Some patients with severely infected conditions may also receive amphotericin B and itraconazole. Although amphotericin B is less effective than itraconazole, it is still a common treatment option. Thanks for watching. Please like, comment, and subscribe for more.